How you doing, guys? Steve here again. I wanted to tell you that I had a heart attack on Friday night. I was in the hospital and I was discharged yesterday. Um, I was driving to a dinner and I felt tremendous pressure right here and inside. It radiated to my back and went down my whole entire left arm up to my shoulder. My shoulder meets my neck and all the way up to the back of my head, and I had such a tremendous headache. And it came out of nowhere. I was just driving. I took myself to an urgent care on the way to the dinner, and my EKG came back slightly abnormal, so they called me an ambulance. Went to the emergency room and they took some blood tests, and my troponin levels, which is your heart enzymes, which if those are elevated means that there's some damage to your heart. Mine were floating around 1.5, and then anything below 0.45 is considered normal. So mine finally flattened out at 1.7 and didn't go up from there. So as a young guy, I'm 29, a lot of doctors thought that it was from drug abuse, or it was from a viral infection that never fully healed and made its way into my heart. But they were wrong. I had a mini heart attack. I had a full blockage in my right posterolateral branch of my right coronary artery. They claim that if you were to choose from which heart attack you could have, this would be the optimal one to have. The reason being is because for your arteries around your heart, they have branches that lead like trees. Picture this is the tree and this is your artery. Sorry for my blood marks, my blood IV marks. But picture this is your artery, and then you have branches that lead to your artery. And this one got clogged. This is the one furthest away from my heart. This one got clogged 100% and was no longer feeding blood to my heart. So this is why I felt the pain. This is why I got kept in the hospital. So they did an angiogram where they shove a tube into your artery, and for me it was right there. And I also have another mark somewhere. I don't know if you can see it. There it is, two of those marks. I got some tubes shoved up my arm, and they put a camera up there that led into my heart to find the blockage, or they were looking for any blockages. They thought they would find nothing, but they found something, obviously. So I have a stent put into my RPL, my right posterolateral, which is a branch off of a branch of my right coronary artery. So they said that this is the furthest branch away from my heart. I have no heart damage. It's just the vein leading up to my artery for my heart that got blocked. Now I know that I've had high cholesterol, and my blood pressure's been fine. My diet hasn't been all that great, and that I'm a smoker. So I've gained about 40 pounds in my depressive episode, my anxiety episode, and that's due to eating like shit. So this further leads into why we should take care of ourselves as best as possible when we are depressed, when we are anxious, when we are suffering from mood disorders. Because it's our life, and the way that we treat our body is how our body is going to react. Now, if your body's not acting properly already, if you have depression, you have anxiety, depersonalization, whatever mood disorder, what have you, you're already stressed out, you're already having a hard time, and you look for different coping mechanisms, and mine particularly are, and I'm trying to stop them, was food and cigarettes. So I was told in the hospital that cigarette smoking, high cholesterol, being overweight, and diabetes, those are all the four main multipliers that can contribute to heart attacks. And being 29, they said I wasn't the youngest, but I'm close to it. Being 29, having a heart attack is definitely an eye-opener. And I wanted to make this video to share it with you guys so that you can maybe have an eye-opener of your own if you are in depression, if you are having trouble with anxiety and mood disorders, to please take care of yourself, because I have not been taking care of myself properly. I've been making improvements with my mood disorders, but the things that I've been doing alongside those have not been beneficial to my health, obviously. So, quitting smoking and eating healthier and exercising have to be a part of my regimen, and it's also going to benefit me as well in my recovery from my depression and my anxiety. So I'm kind of killing three birds with one stone, because this is basically mandated by doctors to do all of these things. And for now I have to be on 5 medications for my blood pressure, my cholesterol, and for thinning my blood thinners, along with my antidepressants and my Klonopin, my anti-anxiety medication. So this is really for everyone out there who's still suffering and not taking care of themselves so well. It can happen to anybody, and it happened to me. And yesterday I was a complete mess, and I felt like, I don't know if you've seen the movie My Cousin Vinny, where Vinny's out and they're camping in the lodge and the log cabin, and his girlfriend is talking about her biological clock and all the shit that's going on, and he says, how much more shit can you pile on to the top of this case? That's how I felt. I felt like, how much more shit can be piled on to the top of my life? What the fuck did I do to somebody? Is there somebody out there with a fucking voodoo doll who's just poking and prodding away at me? What the fuck did I do to anybody to deserve all this pain and suffering? So, after crying and talking to my mother-in-law and talking to my wife, they told me it happened. It's done already. And there's nothing you can do about it. You went to the hospital, you knew something was wrong, and you made the right move. You should be happy that you're alive, and you should be grateful that you're still around and that you were smart enough to go. And they're right. I can't do anything about it. It happened. And there could have been done things that I did differently to prevent it from happening, but I didn't. And this is the warning to anybody out there watching this, that you can do things to prevent your high cholesterol. You can do things to prevent yourself from smoking and unhealthy habits, and being a healthier, better you. And a healthier, better you will also help your mood disorder. So I'm going to end this video with a text message from my 80-something-year-old grandmother, who I think is pretty wise. And she doesn't look her age at all. She looks absolutely amazing for her age. It's probably her Spanish blood. But she sent me the text, and she said, I was shocked and nervous when I heard the news. I'm more than happy that they were able to take care of your problem, and you didn't arrive too late. You must take this as a warning and another chance at life. It could have been worse. You must take better care of yourself. You want to be around to see your family grow with Mary, that's my wife, grow with a father in good health and good spirit. We don't have kids yet, but we're planning on it. Stay away from negative people and thoughts. Change does not happen overnight, but go down the right path so you can live a better life. It's not going to be easy, but you have the choices. Please make the right ones. Now, at the end of that, Stay away from negative people and thoughts. Change does not happen overnight, but go down the right path so you can live a better life. It's not going to be easy, but you have choices. Please make the right ones. I think that goes for every aspect of life, including mood disorders, including overall health. And I kind of took that one to heart, and that really, hit home. So it's true, staying away from negative people, being positive, making the right choices, whether they're lifestyle choices, diet choices, just your overall well-being, who you hang out with, the people that you're around. If they're negative, get into a better place in your life, and things will turn around. So that's going to be some things that I'm working on, and putting this heart attack behind me, and just focusing on getting better from depression and anxiety. So please watch out to your health, guys, and please eat right. And one commercial I did here in the hospital, which was funny, it was just on regular TV, was that over 50% of people who suffer with mood disorders or substance abuse are the ones who smoke cigarettes. And usually it's advertised that way. The cigarettes are to calm you down, they're for stress, but that's not the case. So in the midst of wearing the nicotine patch, and quitting smoking, and bought a bunch of healthy groceries yesterday, it's going to be a lifestyle change, and there's going to be some weight loss, and just all positive things from here on out as far as my health. So that's it on my heart attack. And that's it on my advice for taking care of your body, because it's very important, especially if you have mood disorders. You already have enough stress on your body. You don't want to create more like I did. So use me as a learning experience. A 29-year-old guy who just got married and suffered a heart attack while going through depression and anxiety. Take it from me, guys. Please take care of yourselves. And if you're suffering, if you're having a hard time, just know that it could be worse. And I don't mean that to downsize your mood disorder. And I don't mean that I'm in worse shoes than you are, because I'm in pretty good shoes. And I'm gonna continue to fight. So please keep fighting. Please keep your heads up, and please keep surviving, because it is worth it. Life is worth living. I'll see you guys in the next video. Be well.